Ladies and gentlemen, dear colleague and dear friends, I'm very glad to be with you today in this very important conference. This conference are important not only for the Czech Republic, it's important globally because it's organized during the very strange period of time during the COVID pandemic, and every country in the world is facing with a health crisis. And on most risk are older people. And because of that, it's very important to speak about elder abuse, to speak about suicide prevention, and all topic relevant to the quality of life of older persons. My name is Natasa Todorovic. I'm working in the Red Cross of Serbia now 20 years, and most of the time I'm working in a prevention of elder abuse, advocacy for the quality of life of older people, not only in Serbia but regional one, in Western Balkan country, in the European countries, and globally. And I am European representative for the International Network of Prevention of Elder Abuse. I'm very glad to speak today about prevention of elder abuse in Serbia. It's one topic, and first topic is suicide prevention of older persons. Today I speak about suicide prevention in older persons, and in my presentation shortly I will speak about key statistics on suicide, then statistics on suicide in the Republic of Serbia, older people and suicide risk factor, then very important, especially now, COVID-19 and related risk factor, and the main and the most important part is prevention and intervention. Approximately 800,000 people die due to suicide every year. For every suicide, there are many more suicide attempts. A prior suicide attempt is the single most important risk factor for suicide in the general population. 78% of global suicide occur in low and middle income countries. Ingestion of pesticide, hanging, firearms are among the most common methods of suicide globally. The lifetime risk of suicidal ideation is 30.5%, and the lifetime risk of suicidal ideation with the plan is 3.9%, and the lifetime risk of suicide attempts is 4.5%. The risk of suicide attempts in males is around from 1.3 to 3.8% per year, and for the women is from 1.5 to 10%. Suicide, we need to be aware that suicide is a major public health problem. Around 90% of patients who died by suicide denied suicidal ideation during their last communication with the hospital or healthcare provider. When we speak about Republic of Serbia, the latest data from 2015 shows that the rate of suicide in Serbia 15 is higher than in European Union 13.8. The rate has been steadily declining for several decades, in line with the global trends, and has declined from 20.9 in 1997 to 15 in 2015. When we speak about older person and suicidal risk, World Health Organization statistics from World Health Organization shows that suicide rates tend to rise as a functional of age for both men and women. In the United States of America, older adults only account for 12% of the population, but they account for 18% of suicide deaths. Older people from 75 to 85 years old have higher rates of suicide than those who are between 65 and 75, and individuals 85 or older have the highest risk. More than half of those who die by self-inflicted harm, 54%, have they didn't have any mental condition. On the positive side, the rate of suicide among older persons, while higher than the rest of the population, declined faster as well. Men are far more likely to commit successful suicide attempts. In United States of America, 84% of those with no mental health condition are typically male, and 69 of suicide among those with mental health issue are also committed by men. And we need to be aware about one phenomenon and called silence suicide. Silence suicide is overdose, self-starvation, self-dehydration, and accidents among older persons also suggest that the rates for demographic and underreported, in some estimation by 40%. In Serbia, the trends are same as the rest of Europe, and the risk of suicide increase with the age. In 2005, 50% of all suicide victims were over 60, and 1/3 was over 70. Then in older people age from 80 to 84, there was 69 per 69 deaths of suicide per 100,000 people in 2005, and this one over 85, it's 84.1 per 100,000 people. When we speak about risk factors, first of all, that previous suicide attempts are the main risk factor of suicide. Then adverse childhood experience, stressful life events, family history both of suicide attempts and psychiatric pathology, recent suicide attempt by friend or by family member. Social isolation is risk too. psychological stress, availability of means, and low education or income levels. That's a risk factor, but risk factor in older age, we have first elder abuse, financial loss, social isolation, cognitive impairment, incapacity, medical illness, physical impairments, and other impairments to independent living, loss of the partner. Then divorce. Divorce is a risk factor, especially for older men. Barriers to seeking help, social, institutional, individual, underutilization of mental health services, and overlooked of depressive symptoms by healthcare professionals, chronic pain, forced institutionalization, then ageism, and self-neglect. We need to speak about COVID-19 and related risk factors because COVID-19 risk of suicide increased during an epidemic. We saw that the Spanish flu epidemic was associated with the increase in death by suicide. The outbreak of SARS in Hong Kong in 2003 was associated with significant increase in suicide deaths among older people age 65 plus. A decrease in social integration and interaction during the epidemic and fears caused by epidemic are a big risk factor of suicide. If we speak more specifically for COVID-19 pandemic, the risk are as first social isolation, anxiety, fear, and uncertainties. And the people who are more vulnerable and more in risk is person with the pre-existing psychiatric disorders, person with low resilience, person residing in a high COVID-19 prevalence area, and person who have a family member or friend who has died from COVID-19. We speak about risk factor, but very big thing is protective factors. That's social connectedness, access to the utilization of mental health services, skills of coping and adapting to change, physical activities, and internal locus of control. If we want now to speak about protective and preventive strategies, we need to be aware that access to the both regular and mental health care services is crucial in suicide prevention. The role of general practitioners in recognizing the early warning signs of suicide ideation as well as the condition that may lead to it, such as depression, should be emphasized as they are the ones in direct contact with the population and may significantly contribute to recognize the suicide risk. On the other hand, they also may be very instrumental in ensuring that person who do have some symptoms that demands further explanation and therapy are informed, encouraged, and supported in seeking and receiving specialist services. General practitioners should be the one to encourage help-seeking behavior in their patients, especially men who are less likely to do it. That's first step, because older people going to the healthcare practitioners and they trust in them, and because of that they need to be this first step to referral if someone need more. Then regular screening along the same lines. It is important to introduce routine screening for different mental health issues, but above all for depression. In a large part, this is important due to the against prejudice that exists even among healthcare professionals, that makes depressive syndrome normalized and thus often overlooked, which can lead to them worsening and increasing suicide risk. Subclinic form of depression in older person especially should not be overlooked, since under if if they are not perceived very well, they may worsen and lead to increase the risk of suicide. Identifying the condition and underlying risk early is significant, and it's important that chance that treatment will be successful, and this does contribute to prevention of suicide. Then tackling social exclusion and social isolation. Today we talk about epidemic of loneliness among older person, and this is what also significantly contribute to suicide risk in this population. This needs to be addressed to different forms of social intervention among other things. This intervention can be done at community level and through develop easily scalable, cost-effective programs of including older person in community activity. Risk of suicide is decreased in addition to other positive effects of social inclusion of older persons. Such intervention can be widespread and include as many older people as possible, but there should also be tailor-made approach that should targeting groups in a higher risk, such as older people living alone, persons with functional impairment, survivors of elder abuse. We need to think about these people who are in a higher risk of suicide. The intervention can be implemented by civil society organization, faith-based organization, in order to use the sources effectively and efficiently as possible and avoid overlaps. Then another thing is tele-help SOS suicide prevention telephone line. These prevention modalities are important because they are easily a scalable and continuated the first step for someone who decide to seek help. Therefore, the societies, including the governments, should make a commitment to support these modalities and not leave everything just to the civil society organization. Also, providing support via telephone and other remote means is a very high importance for older person, especially if they have mobility difficulties or live in an area far away from healthcare and other support institutions. And we need to have telephone, maybe one telephone line on a national level or in a local level, just for older person. Then peer support groups. Peer support groups help people to understand that their problems are not unique and that they share them with others, as well as that they can be addressed and solved. Peer support groups need to be supported by society as well as recognized by healthcare professionals as available asset in suicide prevention. During the Red Cross of Serbia has a peer support group for older people, but during the COVID, we started with telephone help or telephone cycle because older people during the emergency situation forbidden to go out, and then they start to talk by telephone, and that something was very successful because they help each other as a peer support through telephone. That then another preventive strategies is access to palliative care and pain management. Special attention must be paid to the pain management and in healthcare, and chronic pain may be one big risk factor for a person already at risk of suicide due to the other factor. Therefore, palliative care services are very important segment of healthcare for older population. And then addressing the ageism and prejudice, prevalenting attitude and that older person are burden to their families and the society mean that allocation of resources in different segments of care and support services may be may be inadequate, and this reduce the capacity of those systems to be effective and prevent suicide. On the other hand, this affect older person sense of self-worth may self-esteem and lead to increase of depressive symptoms. Therefore, fighting and fighting and from fighting therefore fighting and suppressing toxic attitude based on ageistic stereotypes and prejudice is important on several levels and is an important element of suicide prevention. We need to involve older people in all our preventive strategies, and we need to ask older people when we design some policy activities and everything we are doing. Thank you very much for your attention. If you have any question on screen, you have my email. Thank you. Ladies and gentlemen, dear colleagues and friends, today I will speak about system of protection from elder abuse in Republic of Serbia and speak about our experience. Uh, as we all know, elder abuse is a complex problem cross-cutting through public health, social sphere, and other distinct areas, and it is a violation of human rights. It if affects not just the older persons experiencing the abuse and her or his surroundings, but also the society, whole society. The phenomenon of demographic aging has over the past 20 years highlighted the problem of elder abuse, a problem that has for decades been quietly overlooked. Despite the attention that it has now, elder abuse demands additional efforts in at least three different directions. Further research into the phenomenon as a better understanding the scope of the problem as well as its different aspects, raising public awareness of the phenomenon as well as better prevention and better regulatory frameworks. And I will add, we need better coordination and cooperation of different stakeholders on national, regional, and global level. If we speak about Republic of Serbia, Serbian population has less than 7 million inhabitants, with 22.2% of the total population over 65. 57.5% of over 65 were female, as in the other country of all over the world. Older persons' share in the total population will continue to grow, especially women over 18. And we need to plan our systems of social welfare, health system, educational system, and all other system to adapt to demographic aging. And of course, we need to involve more older people in all our advocacy campaign and public awareness. When we start engaging with this problem about 15 years ago, there was only one available Serbian study on elder abuse. It isn't a national study, it was a small regional one. And then we realize that we need more research, because we need to know prevalence of this phenomenon in Serbia, and we need to explore regulatory and institutional framework in Serbia, existing policy and mechanism to prevent and respond to elder abuse, and effectiveness of the system in protecting the human rights of older people, because we all have equal rights regardless of age. Our Republic Institute of Social Welfare in 2016 collecting the data of reported cases of domestic violence and intimate partner violence, and out of number of 23,000
218 reported cases. 30% was reported cases of elder abuse. And in this data, you will see that similar number is in 2010. Prevalence of elder abuse in Serbia, established through research, is higher and is in line with the data from other European countries as well as global data. We establish and we did 3 research studies about elder abuse and 2 studies that have focusing on older people in Serbia, and in 2019 we have then 2 studies about intergenerational solidarity, because we think that we need to change the picture of older people in all generations. First study, it was elder abuse, a study of violence in family context. It's a report providing the overview of existing legal framework in Serbia related to the protection from violence in family context. It also analyzed selected cases of elder abuse. And we have findings identify key problems in the management of elder abuse by institution in related to the provision of psychosocial support and legal protection to older people who experience abuse. And we saw how what is cooperation and coordination between public institutions and what needs to be done to improve this cooperation. The study analyzed the data on violence in the family context, providing from centers from social welfare and police administration from the second and third largest city in Serbia, Niš and Novi Sad, north and south of Serbia. Among the processing cases of family violence, approximately 10% targeting older family members. More than 75 of older persons experience violence in their families were female. The average age of older person who experienced violence was over 70 years. As for the perpetrators, the majority, more than 19%, were male, and most frequently was children and grandchildren of the victims. Physical violence was identified as the most common reason, whereas psychological violence was rarely formally reported. Probably because the tolerance threshold for psychological violence seems to be very high for older persons. Psychological violence needs a more precise definition so it can be better identified by the older person. Then we identify problems here, and we realized that in Serbia, in that research, no established and unfilled way and form through which to regularly and systematically record, document, and processing cases of violence against older persons. We realized that we have for same older persons different data in social welfare center and different data in police administration. We need one entering to the system. Then, no regular practice of exchange information between relevant public institutions. Um, uh, that's second problem. Third problem, not clear who should be responsible for the case management and what the procedure are. Who is safeguarding to older person? And then no specific services of social welfare for older persons survivors of violence in family context, no safe houses, no SOS telephone hotline telephone for older people who are victims of elder abuse, no legal free of charge legal advices. And that's something we realized that it's missing in Serbia. Recommendations were provided to improve the Serbian legal framework, and as well as to the way cases of elder abuse were managed. It's suggesting that the criminal law of the Republic of Serbia especially recognize violence against an older person in family context as a distinct criminal act and aggravating factor. We send this recommendation to the government of Serbia. Second, our research was Introduction to Aging and Human Rights of Older People and pilot research study on financial abuse of older people. Part 1, the concept of human rights. Part 2, review of international, regional, and national legislative framework related to the protection of human rights of older people and anti-discrimination regulation. And part 3, it's exploratory study on financial abuse of older people and case study related to the deprivation of the legal capacity. Field research, it's interviews with 140 randomly chosen older person over 65 in 10 different municipalities in Serbia. And 69% of participation were female, and 69 lived in urban areas, 19 lived in rural areas, and 12 lived in peri-urban areas. What we find, almost 40% of the participants confirm someone else is authorized to use their bank account. 8% state that someone was using their money without their knowledge. Hypothesis arising from the result of the study is there is a market present of strong patriarchal in family relation characteristic by a model of parental self-sacrifice for their children. This increased the risk of financial abuse. And because of that, we ask our participants with one more question. And if they winning on the lottery, 50% of the participants said they would pass the hypothetical lottery winnings on to their children and their grandchildren. Only 9% would use this money for the traveling, or 7% would use to go to the spa or to rehabilitation. We send recommendation to the government of Serbia, and this recommendation was we need to improving the legal framework through amending the family law by addition of typical cases of financial abuse to the appropriate paragraph. A full deprivation of a person of their legal capacity is unacceptable, and the legislation must protect persons' human rights. More in-depth research is necessary with a special focus on the different frauds, practices such as telephone marketing frauds. Public awareness on elder abuse and its prevalence need to be improved. Platforms must be provided for public advocacy activity, ranging from changing the legislative to changing against stereotypes that are among major contribution to the different form of elder abuse. Third, research about elder abuse. The title is Well Kept Family Secret, Elder Abuse. The research was done through telephone, interviews with 800 person over 65. 90.8% of the 19.8% of the population over 65 in Serbia have been exposed to some form of abuse in their older age. 11% in the last 12 months. 11.5% of the population was exposed to some form of financial abuse, and 3.9% of older person reporting physical abuse. 7.8% reported psychological or verbal emotional abuse. And then sexual abuse is definitely a taboo. 50% of our interviewers declined to answer questions related to the sexual abuse. Only one interviewee reported that they were targeting of an attempt of sexual contact by a third party. The sexuality of older person itself is also kind of taboo, and it's rarely even talk about it. And neglect. 3.4% of older people reported neglect, and this percentage was higher, 5% for those who need assistance with daily activities. The data of elder abuse in Serbia is similar to data from global and regional in terms of overall prevalence and prevalence on different forms of elder abuse. And then we have two studies about aging, older people in the rural area and aging in the cities. And when we speak about age discrimination, in this two research, we realized that in rural areas in Serbia, 27% of the participants reporting having personally experienced age-based discrimination, and 33% of urban participants reported age discrimination. In general population, the number is 13%. Older persons appear to be at a higher risk of discrimination than general population. And because of this, we need more public awareness, education, not only older people. We need to educate all population. We need to educate young people in the school, and we need to educate older person too. Awareness raising. We work in 3 levels: in local level, national level, and international level. In local level, a network of the Red Cross branches are a partnership with the local grassroots civil society organization and initiative, and we involve older people in all our activity. Every year, we have education about elder abuse and about human rights of older people. Every year, in every municipality, we try to empowering older people about this topic. And workshop curriculum for older people on their human rights with a large section of elder abuse and protection form of elder abuse. This curriculum we use in Serbia. We shared with our partners in the region, Albania, Bosnia and Herzegovina, Macedonia and Montenegro. And in 2016, the Red Cross of Serbia supported to develop of civil society advocacy networks in Macedonia and Montenegro through EU-supported regional project. When we speak about national level, we Red Cross of Serbia is founding member and coordinator of civil society organization advocacy network Humanas. Humanas advocacies for improved protection of human rights of older people, and one of its main focus is the issue of elder abuse. 18 members organizations in initiative of the network are aimed at policy marks to influence change in legislation so that elder abuse is defined as a distinct act of violence by law. International level, the Red Cross of Serbia is affiliate member of HelpAge International. We are represent international network of prevention of elder abuse in Serbia and in Europe, member of Global Alliance for the Rights of Older People, and Red Cross of Serbia participants in the process of development of the new United Nations Convention on the Rights of Older People. Advocacy experience from the global level are adapted for use in advocacy and national level, and in a local level. We need to spread the word about elder abuse, about the human rights of older people. We need this that older people need to know what is happening in the global level. Red Cross of Serbia also works through the International Red Cross and Red Crescent movement, spread the idea that the movement should be more focused on protection the human rights of older people and to be a part of this global advocacy movement. When we speak about way forward, the Red Cross of Serbia plans for the future include work on several different levels. A plan to undertake a larger scale study using a representative sample on the prevention of elder abuse. A plan to do a prevalence study of elder abuse in residential care of older people in Serbia. We don't have any research in residential care. Other plans include establish cooperation with organizations focusing on other social groups at risk of abuse, such as women, people with disability, ethnic and sexual minority. As a Romanian service provider of care for older persons, the Red Cross of Serbia also plans to focus on deeper cooperation with healthcare sector so that more attention is paid to elder abuse among health professionals. More work should be done on prevention of abuse through providing support to both formal and informal carers and establish support service for older persons who are survivors of elder abuse. And now we have more focus on financial abuse during the pandemic, because older people in Serbia are in risk of financial abuse. We now prepare different education for older people, how to prevent the financial abuse and all forms of abuse during the COVID, and how to prevent loneliness and social isolation. Thank you very much, and see you next time in beautiful Prague.